Good afternoon to you all. Welcome to our channel. Today we'll discuss the differences between hanging and strangulation. Moving to first slide. Here is the newspaper cutting from 3rd of January, and I'd like to point out few discrepancies, few mistakes in this newspaper cutting. As the heading says, 24-year-old man's body found, autopsy reveals strangulation. Moving a little below on this line, it shows the 24-year-old male who was missing for past 3 days. Here it is written past 3 days he was missing. And second, if we go to this column, here it is written police said police said he went missing on 28th, right? Then if we go as per the inquest paper given to the autopsy surgeon, it may be there the body was missing for 3 days, or it may be there the body was missing for 6 days. Why we are discussing this? Because if we go by the inquest paper and when we go to the body, for 3 days missing, for 6 days missing, the decomposition change is taking place in the body within that duration for 72 hours or for 6 days. There is a lot much of difference in the decomposition changes taking in the body. So, autopsy surgeon must rely only on his finding when doing an autopsy, not on the inquest paper given to him by the police. Moving to our topic, hanging versus strangulation. Please pay little attention here. The signs of struggle. The first thing, signs of struggle, they are mostly absent in cases of hanging, whereas they are almost present on the neck of the individual on whom the strangulation has been attempted. The face is pale and petechiae are less common in case of hanging, whereas the face is congested and livid with multiple petechiae in cases of strangulation. Why it is so, we'll discuss further. Signs of asphyxia. They are less marked in case of strangulation, whereas if we look at the case of they are less marked in case of hanging, whereas if we look at the case of strangulation, they are more marked. What are the signs of asphyxia? They are visceral congestion, peripheral cyanosis, petechiae, and fluidity of the blood. Since the degree of asphyxia is very high in cases of strangulation, so the face is pale, congested. The previous one, face is pale and congested, pale in cases of hanging and congested in case of strangulation. Signs of asphyxia, they are less marked in case of hanging and they are more marked in case of strangulation. The protrusion of tongue and swelling, it is again a very good, very common finding in cases of strangulation, and it is less marked or less common finding in cases of hanging. Moving ahead, bleeding from nose, mouth, and ears because of damage to the small vessels. It is a common finding in cases of strangulation, whereas it is very less common in cases of hanging. So things which are common in strangulation are pale face, in cases of strangulation are congested face, signs of asphyxia more prevalent, protrusion of tongue and swelling of the tongue more common in strangulation, and bleeding from nose, mouth, and ears, it is more common in cases of strangulation. Now, if we look at the neck, main organ which is affected in both cases of strangulation and hanging. The neck in hanging, it is stretched and elongated because the force applied is vertical force, body is hanging, whereas in cases of strangulation, it is the force applied which is from the back side of the victim. So the neck is almost no change in dimensions of the neck in case of strangulation. The ligature mark, the most common thing which we look at on the neck is the ligature mark in both cases, in hanging also and in strangulation also. The base of the ligature mark in cases of hanging, it is pale, hard, and parchment-like. Parchment-like. Parchment-like means it is papery, it is hard and pale because of absence of blood below the ligature mark. Whereas in case of strangulation, it is soft and congested. The direction of the ligature mark in hanging, it is oblique. Oblique means it is going upward backward posteriorly, whereas in cases of strangulation, it is almost horizontal or transverse. The continuity of the ligature mark is broken in cases of hanging because of presence of the knot, whereas in strangulation, it is complete. And the level of the ligature mark, it is above the level of thyroid. Why it is above the level of thyroid in hanging? Because of the force applied is vertical, body is hanging and the ligature, it slips, it moves up to the mandible. And in cases of strangulation, it is force applied from the behind of the body, so it is transverse and below the thyroid cartilage. The knot is single, simple and slip knot in cases of hanging. In cases of hanging, again I'll say it is single, simple and slip knot, and it is generally on sides of the neck, either side of the neck, whereas in cases of strangulation, it is multiple and reef knot. Now the injury to the neck in case of hanging or strangulation, abrasion and ecchymosis on edges of the ligature mark in hanging, they are very less common. Very less, it's a very less finding, whereas they are a very common finding in cases of strangulation. Involuntary discharge of excreta and urine, it is a common finding in cases of strangulation. Because of the degree of force applied on the neck, it is very high in cases of strangulation. Involuntary discharge of seminal fluid is common in hanging, but it is less common in strangulation. Bruising of neck muscles, it is common again in strangulation, but less common in hanging. So the abrasion, ecchymosis and bruising of neck muscle, they all are indicators of the force applied on the neck, hence they are more common in strangulation. As a result of force applied on the neck is very high or great in strangulation, so the subcutaneous tissue, it is damaged more, hence it is echymosed in cases of strangulation, whereas it is white, hard and glistening in cases of hanging. Fracture of the thyroid cartilage, it is a unlikely finding in cases of hanging, whereas it's a very common finding in cases of strangulation. Again, as a result of severe asphyxia in strangulation, it is very common finding. The emphysematous bullae on lung, it is a very common finding in case of strangulation. History of similar episode, similar unsuccessful attempts, it is present in cases of hanging in comparison to strangulation, which is absent. The history is almost absent, or we'll say it is absent in cases of strangulation. So side note, it is generally seen in cases of hanging, but absent if we look at strangulation. Next few findings, they are uncommon. Fracture of hyoid bone, it may occur in cases of hanging, but uncommon in strangulation cases. Fracture of larynx and trachea, they are unlikely in hanging, but may be found in cases of strangulation. And damage to the carotid artery, it may be seen in cases of hanging, whereas it is a uncommon finding or rare finding in cases of strangulation. So this was whole lecture for today, and here we have summarized the differences between hanging and strangulation. Kindly like our channel. Please like, subscribe and share our channel. Thank you.